Let's explore the incredible complexity and vital functions of the circulatory, respiratory, digestive, musculoskeletal, and nervous systems in a way that's easy to understand. This course provides essential knowledge of major body systems, including the circulatory, respiratory, digestive, musculoskeletal, and nervous systems. CNAs will learn how to understand these systems' anatomy and physiology, and apply this knowledge to providing effective patient care, recognizing conditions, and preventing complications. The human body consists of multiple systems that work together to maintain health and function. CNAs play a critical role in supporting patients with conditions affecting these systems. This course covers the structure, function, and disorders of the circulatory, respiratory, digestive, musculoskeletal, and nervous systems. By understanding the physiology of these systems, CNAs can provide informed, effective, and compassionate care to their patients. Introduction to Body Systems and CNA Care. The human body is a complex organism made up of various interdependent systems, each playing a vital role in maintaining health and function. For CNAs, understanding these systems is essential because care decisions and interventions often relate directly to how these systems operate. Homeostasis, a critical concept where the body maintains internal stability, temperature, fluid balance, pH, despite external changes. CNAs must understand that illness or injury can disrupt homeostasis, necessitating attentive care. Interconnectedness of systems. For example, the respiratory system supplies oxygen to the circulatory system, which transports it to tissues. Dysfunction in one system often affects others. Role of CNAs. CNAs assist in monitoring and supporting these systems by performing tasks such as vital signs monitoring, assisting with mobility, providing nutrition, and reporting any abnormalities. Communication. CNAs are the eyes and ears of the healthcare team, so a solid understanding of body systems helps in recognizing subtle signs of decline or improvement. The circulatory system, structure, function, and CNA care. The circulatory system consists of the heart, blood vessels, and blood, responsible for transporting oxygen, nutrients, hormones, and waste products. Heart, anatomy, and function. A heart has 4 chambers, 2 atria and 2 ventricles that pump oxygen-rich and oxygen-poor blood throughout the body. CNAs should recognize the importance of this pumping action and how it affects organ function. Blood vessels. Arteries carry oxygenated blood from the heart to the body. Veins return deoxygenated blood to the heart. Capillaries facilitate exchange of gases and nutrients at the cellular level. Blood components. Red blood cells carry oxygen. White blood cells fight infection. Platelets help with clotting. Common disorders. Hypertension, high blood pressure, can cause strain on the heart and blood vessels, often asymptomatic but can lead to stroke or heart attack. Heart failure occurs when the heart can't pump effectively, leading to fatigue, swelling, and shortness of breath. Atherosclerosis. Plaque buildup narrows arteries, restricting blood flow. CNA care role. Monitor vital signs, especially blood pressure and pulse. Observe for swelling, edema, shortness of breath, chest pain, or cyanosis. Assist with mobility and positioning to improve circulation. Encourage adherence to prescribed diet and fluid restrictions. Report any new or worsening symptoms promptly. The respiratory system, structure, function, and CNA care. A respiratory system manages breathing and gas exchange, supplying oxygen to the body and removing carbon dioxide. Anatomy includes nose, mouth, pharynx, larynx, trachea, bronchi, and lungs. The alveoli within lungs allow for oxygen, carbon dioxide exchange. Breathing process. Inhalation brings oxygen-rich air into the lungs. Exhalation expels carbon dioxide. Common respiratory conditions. Asthma, airway inflammation causing wheezing and difficulty breathing. Chronic obstructive pulmonary disease, COPD. progressive airway obstruction leading to chronic respiratory distress. Pneumonia, infection that inflames lung tissue, impairing oxygen exchange. CNA responsibilities: monitor respiratory rate, rhythm, and effort. Use pulse oximeters to track oxygen saturation. Assist with positioning patients upright to ease breathing. Encourage deep breathing and coughing exercises. Recognize signs of respiratory distress. Example, cyanosis, use of accessory muscles. Follow oxygen therapy guidelines as prescribed. A digestive system, structure, function, and CNA care. The digestive system breaks down food, absorbs nutrients, and eliminates waste. Anatomy and function. Mouth. Begins digestion through chewing and saliva. Esophagus. Transports food to the stomach. Stomach. Mixes food with gastric juices for breakdown. Small intestine. Absorbs nutrients into the bloodstream. Large intestine. Absorbs water and forms stool. Common issues: gastroesophageal reflux disease, GERD, acid reflux causing discomfort. Constipation, infrequent bowel movements due to diet, inactivity, or medication. Diarrhea, frequent loose stools caused by infections or digestive disorders. CNA care. Assist with feeding and monitor intake and output. Encourage fluids and fiber intake to maintain regular bowel function. Monitor for signs of nausea, vomiting, or abdominal pain. Assist with toileting and maintain dignity. Report changes in bowel habits or appetite. The musculoskeletal system, structure, function, and CNA care. The musculoskeletal system supports movement, stability, and protection. Components. Bones provide framework and protection. Muscles facilitate movement. Joints connect bones and allow flexibility. Disorders. Arthritis, joint inflammation causing pain and stiffness. Osteoporosis, decreased bone density, increasing fracture risk. Muscle atrophy, muscle wasting from immobility or illness. CNA role. Assist with safe transfers and ambulation. Encourage range of motion exercises. Prevent pressure injuries through frequent repositioning. Monitor for pain or changes in mobility. Use proper body mechanics to protect self and patient. The nervous system, structure, function, and CNA care. The nervous system controls body activities, sensations, and cognition. Components. Central nervous system, CNS, brain and spinal cord. Peripheral nervous system, PNS, nerves connecting CNS to body. Functions. Motor control, sensory input, coordination, and thought processes. Common conditions. Stroke, disruption of blood flow to the brain causing paralysis or cognitive deficits. Dementia, progressive loss of memory and cognition. Parkinson's disease, movement disorder caused by nerve degeneration. CNA care. Assist with communication and mobility. Monitor cognitive status and behavior changes. Provide safe environment to prevent injury. Support ADLs with patience and empathy. Report any neurological changes immediately. Common conditions and diseases affecting each system. This module reviews frequently encountered diseases, their symptoms, and CNA care considerations across all systems. Emphasis on symptom recognition and timely reporting. Examples include hypertension, circulatory, pneumonia, respiratory, GERD, digestive, arthritis, musculoskeletal, and stroke, nervous. Case studies highlighting CNA interventions and preventive care. How CNAs support recovery and prevent complications. CNAs play a vital role in patient recovery by assisting with therapy exercises, promoting mobility and independence, preventing falls and pressure ulcers, encouraging nutrition and hydration, monitoring and reporting early signs of complications, providing emotional support and patient education. Conclusion and recap. By deeply understanding these critical body systems, CNAs enhance their caregiving effectiveness, ensuring patient safety, dignity, and improved outcomes through informed, compassionate care.